Hello everyone, you're welcome back to my channel. If this is your first time here, you're welcome. I make content about medical, fashion and lifestyle. And for my returning viewers, thank you so much guys. I love you all. Don't forget to hit the subscribe button if you're yet to do so, and turn on the post notification so you always get notified anytime I post a new video here. Today's topic is miscarriage or spontaneous abortion. Miscarriage is a sudden loss of pregnancy in the first 3 months of pregnancy or the first 20 weeks. It's also 3 months. And late abortion happens after 20 weeks of gestation. So what I'm trying to say, let me break it down for you guys. Loss of pregnancy before 20 weeks is early miscarriage, and loss of pregnancy after 20 weeks is called late miscarriage. So what are the causes of miscarriage? The number one cause of miscarriage is genetic factor. Yes. During implantation or during conception, a man contributes 23 pairs of chromosome and a woman contributes 23 pairs of chromosome. If any of the partner contributes abnormal chromosome, it's going to end up forming abnormal fetus or baby. And when there is abnormal fetus, like when there is missing or more chromosomes baby growing in a woman's body, the woman's body will try as much as possible to force it out, to eliminate it, because something is missing. It is not complete. It's either it is less or it is more. Remember, genetic is very, very important. I mean gene, because gene to determine all the person's physical attributes. I mean in the sex, the hair type, the color and so on, the skin color and so on, and also the eye. Yeah, and that is it. This is why this is very important. Genetic factor leads to, at least genetic factor is one of the number one cause of first trimester miscarriage. The second cause of miscarriage is low level of hormone, especially when we're talking about pregnancy hormone or fertility hormone. It has to do with progesterone, estrogen, luteinizing hormone and so on, but the one we have to focus more here is progesterone. When there is low level of progesterone, there is no way the baby is going to be nourished, because this is a hormone that actually nourishes the baby inside the womb. So when there is low level of this hormone, there is nothing to sustain this baby inside, and thereby it will lead to elimination. The baby will come down automatically. This is the second reason. Low progesterone, hypoprogesteronemia, that is what is called, low level of hormone. It could be the second reason why you're having a miscarriage. The third cause of miscarriage is rhesus incompatibility. You know, when you go to a hospital for blood test, and they give you something like blood group A, B, O, then you have this plus sign there, like plus and minus. That indicates positive and negative. That indicates your rhesus factor. It's either you're positive, for instance, maybe A positive, O positive, or O negative, or and so on. That is a when you have, for instance, A positive, and when the father is positive, rhesus positive, and the mother is rhesus negative, here is the problem. The baby is going to be rhesus positive child. Yes, in the first pregnancy there won't be any problem because the body is not yet sensitized. The problem comes in the second pregnancy, because this is very common, because after a woman have their first child, some people actually complain of miscarriage after their first child. This is because of rhesus incompatibility. The woman is rhesus negative and the husband, the partner, is rhesus positive. So the child forming in there is going to be rhesus positive. Like I said, in the first pregnancy, there won't be any problem. But in the second pregnancy, the body would have recognized this growing fetus or baby in the woman's body as a foreign body. Thereby, it will try as much as possible to get rid of it, because it sees it as a foreign body, because it is rhesus positive while the woman is rhesus negative. In the second pregnancy, the mother's body is going to recognize or dictate the growing fetus or baby in her womb as a foreign body, and thereby it will try as much as possible to get rid of this baby. And this is miscarriage. There is no way the baby is going to stay, because the body is seeing it as a foreign body, because it is rhesus positive and the mother is rhesus negative. So when this pregnancy comes down or she loses the pregnancy, it is miscarriage. This is the third cause of miscarriage. The fourth cause of miscarriage is cervical incompetence. Cervical or cervix, it's like a entrance or mouth of the uterus, where something, let's say this is our uterus. Sorry, this is not the uterus, but I'm making this for you to understand. Let's say this is our uterus. So the lower part here is the cervix, right? And this is supposed to be closed during pregnancy. But when this thing beginning to widen up a little bit during pregnancy, in the middle of the pregnancy, it starts opening and widening. What is going to happen? The content is going to result to miscarriage, because it's going to come down automatically, because this is not closed. Usually as a result of weakening muscles around this place is weak, it will be unable to hold or keep the baby inside the womb. Thereby it will lead to elimination of the baby. This is the fourth cause of miscarriage. The next causes of miscarriage I'll be discussing with you today is fibroid. Yes, I'm going to make it very easy for for you to understand. It's more like abnormal growth on the wall of the uterus. The uterus, during implantation, it should be free. There is a place in the womb or uterus where the baby is going to stay to implant itself. It attached itself to the wall of the uterus. But when there is fibroid, and fibroid too, it grows, from little cells, abnormal cells, it grows, becomes big. So when there is abnormal growth on the wall of the uterus or the womb, there is no place the fetus or the baby is going to attach itself to grow inside the uterus or the womb. So thereby, what is going to happen? It comes into the uterus or the womb to attach itself to the wall. But when there is abnormal growth already in the wall of the uterus or the womb, there is no way the fetus or the baby is going to attach to inside the womb. I'm trying to make this as clear as possible, and thereby it will come down. It will lead to elimination. It will come down automatically, because it can't attach itself to the wall of the womb or the uterus. And this is another cause of miscarriage. Another cause of miscarriage is infection. A lot of infections can lead to miscarriage, and like chlamydia, syphilis especially can lead to miscarriage. And some underlying health issues in a woman's body, like heart disease, diabetes, severe kidney disease, and so on, they can all lead to miscarriage. And what is the treatment? How do we treat this? The treatment depends on the cause of the miscarriage. If the cause of the miscarriage is as a result of low hormone, low progesterone, hypoprogesteronemia, like I said, the woman is going to be given an hormonal replacement therapy, but this will be done after she might have done hormonal test. If her level of hormone is very low, she'll be given an hormonal replacement therapy. If the cause of this miscarriage is fibroid, she needs to go for scan to be able to know if it is fibroid or another thing, or cervical incompetence, that is weakening of the cervix muscles. So if this is a result, For the treatment of the cervical incompetence is usually cervical sacrilege. Cervical sacrilege is when this part of the uterus that is weak, this lower part, they're going to tie it to be able to keep the baby inside. They're going to stitch it or tie it this place, so to keep the baby till term. And when she wants to deliver, they're going to lose the stitch, then she will be able to give birth normally. So this is cervical sacrilege. If the cause of the miscarriage is infection, she might be given antibiotics, she might be given antifungi and so on, depend on the cause of the infection. Another treatment is if the cause of the miscarriage is viscous incompatibility. There is no problem. Simply what she's going to do is visit a doctor, get a test done, and she'll be given anti-D. Anti-D is like vaccine. After her first child, she'll be given an injection, anti-D injection, within 72 hours. After her first child, she'll be given this. When she gets pregnant in the second time again, she'll be given another anti-D injection at 28 weeks. Yes, at 28 weeks, that is 7 months. And when she gives birth again, the second child, within 72 hours, she's going to be given another anti-D injection. It's just like vaccine, and everything will be resolved. So there is nothing to be worried about. They're all treatable. I hope somebody finds this very helpful. Kindly hit the subscribe button and turn on the post notification. Like, share, and drop comments in the comment section below. I will see you guys in my next video. Thank you.